One of the first full rollouts of Psyomics is taking place here at the Hertfordshire Partnership University NHS Foundation Trust. It's known for its innovative approach in using technology to help support its mental health professionals. David has completed the Psyomics online assessment that will give mental health clinicians a first insight into the issues he's been facing. A process that would usually take up to 2 hours face-to-face. Filling out this detailed assessment before their appointment means the clinician can be steps ahead when they meet and already have an idea about the best options for support.
This is going to be a great initiative from the service users and carers' point of view, because they are not going to wait for that long for initial assessment. So that was the first thing we thought which would benefit our service users and carers. And then the amount of information which is generated, and including some kind of algorithms used within the digital document, we are not completely relying on that in terms of the pointers towards diagnosis. That in itself is quite a positive development.
The effects of waiting for mental health treatment can be damaging. 1 in 4 people experience a mental health problem every year, and there are currently up to 1.6 million people waiting for support. Almost 40% of these said that waiting for treatment had led to a further decline in their mental health. The mental health professionals providing care also need support to help those in need. There is a great need for mental health services to embrace technology to help the professionals working in these services provide support to all the people who need it.
The volume of patients coming to the NHS, for instance, has increased exponentially. The volume of clinicians has not increased at the same rate, and the NHS hasn't got bucket loads of spare money to train people either. So really, it has to turn to technology to help.
Most people go to their GPs with mental health problems. The GP then has to make a referral to a mental health assessment and treatment service. The hope is that a digital assessment like Psyomics will help to speed things up and get patients into the right treatment for their needs at the earliest opportunity.
So if the questionnaire collects this information and then I see the patient, I will not have to go with them through it, note it all down and then type it. But that will have been collected, and then I can sit with the patient and talk to them about the things that really sort of are important to the person.
Innovation is seen as the way forward to help meet the needs of both patients and clinicians, as well as address some of the challenges with waiting lists in the NHS.
What Psyomics solution allows us to do is to give our service users the option to tell us their story at a time and a place of their choosing. At the moment, they have to do this at the initial assessment, which can at times be stressful for the service user. We think that this approach will not only improve the quality of our initial assessments, but ultimately save time to our clinicians and service users, which means this time can be reinvested in time to care to help us see more service users and help more service users, ultimately helping us to meet some of the increased demand we're seeing following the pandemic.
When a patient sits in front of me, they have not seen me before. It's sometimes quite intimidating as well to be asked all these personalized questions about your innermost feelings. So here they will have had the time to do it in their own time. I will see it, and then we can discuss it, and they can hopefully feel more at ease about it as well.